All right, so why don't we go ahead and get started? My name is Thomas Helgerman. I'm an assistant professor at the Carlson School at the University of Minnesota, and I'll be the chair for our session today, our last session on education pathways. So I'll start by introducing our first speaker, Anthony Bald, to present his paper, The Birth of an Occupation, Professional Nursing in the Era of Public Health. So Anthony is an assistant professor of economics at California State University, Fullerton. His research spans policy-relevant topics in labor economics, health economics, economic history, and child welfare. He received his PhD in public policy from Harvard University in 2025. So go ahead, Anthony.
Great, thanks, Thomas, for that introduction. I'm thrilled to be here to present my paper. I have a small disclaimer here that I won't read, but this work was supported by many folks, and I'm very grateful for them. So to sort of set the context here, I want to start by focusing on women in general in US history. So we know, of course, from lots of work from Claudia Golden and many others that the entrance of single and married women into the formal labor force was sort of one of the largest economic shifts of the early 20th century. It reflects the U-shaped relationship in economic development that we've seen not just in the US, but in other countries. And many factors, which there's a lot of literature behind this, drove the rise in female labor force participation. So we know education was expanding during the early 20th century. There was a labor demand that increased during wartime that drew women into different occupations and industries. And there were also innovations in technology and medical progress that drove women's entry into the workforce. And what I'll be focusing on in this paper is more about how jobs and work changed in ways that made work more appealing to women and more accessible to women in different sectors. So there's some evidence on teaching and pharmaceutical work, but I'll be focusing on nursing, as in particular the professionalization of the nursing field. We have little evidence on how professionalization actually changed entry into the nursing profession. I put the sort of generic definition of a profession up here, where we think of professions as work that requires extensive training, mastery of specialized knowledge, usually has professional associations affiliated with the work. And so I'll be talking a lot about how nursing went from work to a profession, and I call this the process of professionalization. And so in this paper, as I say, I study the birth of the professional nurse in the early 20th century. In 1870, just to provide a little bit more context, nursing was largely unregulated and had a relatively low social status, very similar to domestic service. I'm citing Rosenberg here. But by 1930, nursing had actually transformed quite a bit into a professional occupation with formal training, licensing, and associations. So quite a transformation over this 60-year period. And I put some images up here to show you sort of the canonical images of nursing during this period. And this is essentially what was formed during this process of professionalization. We had the sort of uniforms, the alumni associations. And so the canonical image of nurses that we think of in US history was formed during this period. And so to give you a little bit more details on the development of nursing, Florence Nightingale is a name that many of you probably know, who pioneered the model of nurse training in England in 1860s, and the US hospitals began adopting that model in roughly the 1870s. This model looked like an apprenticeship style program. So for those of you familiar with the European style of vocational training, this looks a lot like that. It was based on admission, based on a woman's background and a short probationary period for women to demonstrate their skills in the hospital. The nursing school was affiliated with the hospital, and they were women were offered lectures in medical topics, and they were given clinical exposure. So this was one of the only ways that women during this period could actually get this type of training. They were provided a small stipend to compensate them for their clinical work, and it was the primary pathway for nurses to become certified during this era. So a fun historical tidbit that I always put in here is that the abbreviation RN, which we still use today, comes from the fact that in the 1920s, there were actual paper registries of nurses that had graduated from training schools. And so we still use that abbreviation today. So getting to my paper, so I focus on the rise of professional nursing and how it affected economic outcomes for women during this period. I'm going to use linked census data, which we've heard a lot about, and I'll be focusing on cohorts that were born between 1885 and 1900. To sort of operationalize this, I think about professionalization by measuring the growth of nurse training schools. These schools were established during the era of public health from 1890 to 1936. And I'm going to digitize the school level data from historical records, including the biennial surveys, as well as the American Nurses Association. And so I'll show you some figures of what the spread of these schools looked like. So in 1870, there were essentially no programs like this, but then these schools expanded quite gradually until about 1930, when they peaked at about 2,000 in the US. There's a lot happening after 1930. There was World War II. The numbers of schools and students started to diverge in their trends. And so actually, I'm going to be focusing primarily on this period of growth through 1930. In terms of the geographic expansion, they started primarily in urban centers in 1890, and then sort of as we move to 1920, you can see the expansion that happened quite gradually, with some small towns having just one school to large cities having many schools. In terms of the actual sample I'll be focusing on, like I said, I'll be focusing on native-born white women born in the US between 1885 and 1900. I observed these women for the first time in 1900. Of course, we don't have the 1890 census. And then what I'll do is I'll measure their outcomes linked forward to the 1920 and 1930 censuses. I'll be doing this linkage using the census tree. I'm excited to update this paper with the other methods that folks have talked about, but I'll be using census tree primarily because of its coverage of women that changed their last names. I should also mention that I focus on native-born white women. That's in part because linkage rates are better and more accurate for this group, but it's also because historically, the US has a long history of racial discrimination, and non-white women in general were not admitted to these types of programs during this period. So I focus on native-born white women, in particular these cohorts, in part because, as I show on the graph, these women were born approximately when the number of schools was increasing quite rapidly. In terms of my estimation approach, I'm going to be thinking about access to professionalization and access to nurse training as it was determined by both your distance to school and your age. And so the way I think about this is that a new training school is going to lower the cost of you becoming a nurse, especially if it opens in your town. A new training school is also primarily going to affect those women who are on the cusp of entering the labor market. So they've just graduated from high school, for instance. The entrance age for these programs was approximately 18 to 21. And so essentially what I do is I employ a two-way fixed effects approach to use variation in the training school openings to identify the effects of access to nurse training. There are many ways to do this, and I've done this a number of ways, and it doesn't affect the results or the conclusions that I draw, but the way I operationalize this is I could define treated women as women that were within 5 miles of a program that opened when they were in their adolescence. So you can think of women in a city or town, they're graduating from high school and a new program has opened nearby. And what I'm actually going to do is I'm going to restrict my sample to women who were either slightly further away, so they're within like a 10-mile radius, for instance, or they were slightly older and they were much less likely to join a nursing program. The idea here is to shift the marginal likelihood of women entering nursing based on their distance and age, and then I can do a lot with that. I'm of course going to control for baseline birth year, location fixed effects, and demographic information that I observe in childhood. And I'm excited to revise this paper. I've gotten a lot of feedback on how to improve this particular aspect of the paper, and as I revise this, I'm excited to explore those other methods. So the primary result here for 1920 is that I can show that I shift women into nursing using my measure of proximity. It's notoriously perhaps difficult to shift occupation in a very precise way, but what I show in the paper is that women who are close to a school when they were in adolescence are approximately 20% more likely to work as a nurse in the 1920 census. Of course, the definition of working as a nurse is based on the census coding of women who were gainfully employed in nursing in 1920. If you split this out by subgroups, it is fairly aligned with historical evidence that most of the women who were working in nursing were single women and who were working in the labor force. So I plot these coefficients in part to show you how the magnitude of that changes by subgroup. And so essentially, what I'm able to show using this variation is I can look at heterogeneity by background. So I can show how access to training affects women who are from different backgrounds using your father's occupation in 1900. So what I actually show is that women from sort of professional or white-collar backgrounds were more likely to take up nursing in response to an opening. That's actually quite interesting, and it aligns with some of the more anecdotal work from Rosenberg and others about how nursing was professionalized and attracted women from perhaps higher status backgrounds. I don't see any strong substitution patterns away from any single occupation. This went a little bit against my priors on this. So I thought, maybe all of these women would have become teachers, but in fact, the coefficient on teaching is negative, indicating perhaps some substitution away from teaching, but it's not statistically significant. And the way that I think about occupational income in this setting, Kelsey had a great presentation on occupational income scores, which I do use to try to measure the effects on sort of aggregate income and economic status. My effects here are small and insignificant, and the way I think about that is nursing is sort of this sort of middle of the road occupation. It's not particularly high or low earning, and so if you're pulling women from different parts of the wage distribution into the center, you might not expect a strong increase in their occupational income score. So my conclusion here is that the availability of nurse training led to women from relatively higher status backgrounds to take up nursing and substitute away from other work in the short run. And by 1930, what I show is that women in the sample are older, so 75% are married, but I show an increased attachment to nursing among married women in 1930. And I also show some interesting dynamics on the side of physicians. So I had a potential hypothesis that giving women access to this type of training could increase their likelihood of pursuing MD degrees and becoming physicians. I don't find any evidence of that. In fact, it looks like women who had more access to nurse training were less likely to become physicians and more likely to marry a man who was a physician or in a healthcare occupation, although those coefficients are a little bit noisy. So in conclusion, professionalization of nursing via nurse training schools really ushered primarily white native-born women into the nursing field during the early 20th century. The gender and racial composition will actually remain quite stable in nursing until about 1950, when more men and more Black women began to enter in larger numbers. And interestingly, in the historical context, we don't see a lot of these nursing schools around today, and that's in part because nursing would eventually transition into the university setting and experience strong relative wage growth. So if you compare nurses to, say, teaching, nurses have experienced much stronger wage growth. And so this early period was actually quite critical in establishing white women in the nursing field and then allowing them to experience that strong relative wage growth in the decades to come. I'm really excited about some of the ways I'm revising this paper. I'm working on the link to the 1940 census, as well as other measures of economic status and bringing those into the paper. I'm really excited about the diffusion of public health knowledge. So one of the things that nurse training schools did was they trained women in sort of the frontier of medical knowledge. These women then went out into the community and they could do things like advise immigrant families on best practices in hygiene. And so I think there could be a very tight link between the knowledge that training schools were providing and local mortality. I'm also very interested in the shift of nursing into universities and overall female educational attainment. Great, so that's the paper. There's a lot more in the paper, and those are my contacts. Thanks so much.
All right, so next we have Catalina Lauer presenting her paper, Access to Reproductive Health and Gender Gaps in Education. Catalina is a PhD candidate from GS-EFM. Her research focuses on the economics of education, gender, labor, and applied econometrics, with publications in economic policy in the Journal of Applied Economics. She has taught at universities in Germany and Chile and presented her work internationally.
So thank you so much for having me. I'm very happy to be here presenting our work, Access to Reproductive Health and Education Outcomes. It is work in progress, so all of your comments and questions do help us improve. So this work is along with Diana Kruger from Adolfo Ibáñez University and COES, who is actually funding this project, and Carolina Molinare from Diego Portales University. So let's talk a little bit about adolescent motherhood. We all know that it leads to the adverse socioeconomic outcomes. We know that it increases high school dropout, that it lowers educational attainment, it lowers future employment, and it also increases future poverty rates and public assistance. So there is very robust evidence that the impact to access and birth control and planning family methods does decrease teenage pregnancies and can improve women's higher education and future labor outcomes. One particular form of birth control that I expect to talk about today is the emergency contraception pill. And it is a very interesting contraception to study because there's not a lot of studies. They are all in different countries and they have found mixed effects. There is also relatively less evidence on the impact of access to contraception and high school outcomes in particular. There is some for girls, but there is almost none for men. So the two questions we want to answer with this project is, first, does increased access to contraception can improve adolescent secondary education outcomes, and this would be through the mechanism of reducing adolescent parenthood. And can ECP eventually reduce inequality through benefiting lower income teens? We're not all done with this question, so pin it, we will have it soon enough. But let me show you what we have so far. So we made the following contributions. First of all, we are the first to study the causal effects of emergency contraception and high school outcomes, and we have very nice data, which allows us to study dynamic effects. We also do analyze the effect on both boys and girls, since boys have not been as studied as women in the case of adolescent parenthood. So to tell you a little bit about the Chilean context, 12% or so of secondary education, secondary students fail a grade, which means they're not promoted to the next grade. Then 8% who are enrolled in last year of high school do not actually graduate from high school. And then 4% of all students abandon secondary schooling. This is based on the official measure from the Ministry of Education, which means that since the last enrollment, if 2 years have passed and the student does not re-enroll in school, then they are considered dropouts. Of course, these averages do hide differences across gender and income levels. I mean, boys in both rich and poor households are more likely to drop out. And of course, as we would expect, poorer boys also are more likely to drop out of school. So since I am talking so much about adolescent parenthood, you might be wondering if adolescent parenthood is prevalent in Chile. And I would say, yeah, unfortunately. If you see cohorts born between 1987 and 1997, you can see that around 1 in 5 girls became mothers before turning 20 years old. For men, this number is a little bit lower. You can see it's between 1 in 12 and 1 in 10. But still, I would argue that this is a pretty high number, and a lot of girls in the educational systems are affected by teenage parenthood. So let me tell you a little bit about emergency contraception. So the emergency contraception pill, in a very rough summary, because we could make a whole presentation only about this, is used to prevent pregnancy after unprotected intercourse or contraceptive failure. So it is intended as just a one-time solution. It is not a regular form of contraception, and it works through delaying ovulation or preventing implantation. During the period of our study, Chile has one of the most strict anti-abortion laws worldwide. Abortion is not acceptable or legal or permitted in any circumstance whatsoever. And this made the emergency contraception pill the only legal resource for women to prevent the pregnancy after intercourse. And unlucky for Chileans, but lucky for us as researchers, due to political and administrative changes, there was unequal geographic access to ECP between the years 2009 and 2015, which allows us to draw this natural experiment and make some interesting research. So the data we're using is mostly administrative data from the Chilean government. On the one hand, we have the Ministry of Education administrative data, which gives us student-level data in particular. So every student that has ever enrolled in the educational system in Chile, private, public, whatever, we have information on that student. We know all of their school-level outcomes, grades, attendance, enrollment, etc. We also know their student characteristics, and we also have characteristics on each school in particular, including the school's location. Then we have also Ministry of Health administrative data at the health center level, which allows us to have information as, for example, how many people went to the health center asking for the ECP? How many people actually got the ECP? Who gave it to them? A nurse, a midwife, a doctor? We know all of that. We also have information on the center, location, etc. We also use some other sources of information to have some other types of information, such as, for example, school socioeconomic information that we obtain from the standardized test, SIMSE. We also use this socioeconomic characterization survey to have some municipal level control variables, as well as the youth survey and HUF, which gives us some rough regional shares of contraceptive use and some administrative electoral data. So with these data sets, we are able to create a very comprehensive data set following students over the time. We have information on whether the student is enrolled in school in a given year, the share of days monthly that the student attended to this school, if the student is promoted to the next year, we also have their grades, but we're not using them now. we also know if they graduate high school and if the student drops out based on the measure of the Ministry of Education. In honor of time, I will just continue, but we have also a bunch of covariates. And let me tell you about how we measure the access to ECP. That is not that easy. It would be ideal for me to have the address of the students and know how far away they live from a health center that is actually distributing the pill. However, the Chilean government does not want to give me that information. I have asked, and they keep on saying something about, data privacy. So unfortunately, we have to find the second best option. And it's not far-fetched to think that the school is a very nice proxy for address of the student. Actually, data released by the Ministry of Education shows us that students live on average 2.5 kilometers away from school. So based on that, what we do is use the school's address as the proxy for the student's address, and we observe if the student lives, or well, the school is located within 4 kilometers of a health center that is distributing the pill. Based on this, we also do 1, 2, 3, 4, 5, 10 kilometers. We're presenting 4 kilometers. And with this, we are able to create a better measure than other literature has created. Most other literature uses municipality, county, region as the measure. However, that does create some spillover effects where we are neglecting the fact that people can actually go and cross municipality boundaries to obtain some health services. So, our methodology is pretty simple. I will go very fast. We will use the event study that we all know, hate, and love. The Cleven one, we all know it. So basically, all of my time event dummies will be set based with the year prior to the ECP being made available within 4 kilometers of the school. So let me show you that our sample is around 7,000 schools, 1.3 million students across 6 cohorts. So we observe the student when they enter 7th grade for the first time between 2006 and 2011, and we observe them year by year until they either graduate from high school or they turn 24 years old. And on average, we observe them for 7 years. They should take 6 to graduate. On average, we're observing 7. So let me show you our most important results. I wish I could show you all of them, but I will stay with these ones, which are the most important. So, very surprising. We were really surprised with these results. We were not, our hypothesis began with the idea that we would probably find some effect for boys, but we were not expecting to find effects for boys that were as high as the effects for girls. This does, however, make sense because we know that boys do drop out from school at higher rates than women. And not only drop out from school at higher rates than women, they are more likely to drop out of school if they become teenage parents. There is some evidence that shows that boys do drop out more when they have babies. However, we should look more into that. It is very interesting that dropout is a very modest effect in comparison to the other ones. Attendance, for example, we can see the effect is positive. It does make sense. When I do not get pregnant, I also do not have to care for a child, so I can go to school. And same with grade promotion. Then I have time to study for my final exams. So our results are very interesting. We are not yet 100% sure why the effect on boys is higher than the effect for women. We are still looking into that. And we also perform some heterogeneity analysis to observe if there's differences for income level. I am not showing those results today, but for now, it seems that income level does affect everything but enrollment. main reason why I'm maybe not showing it. Uh, but it is indeed very interesting results, the fact how they grow over time. Especially because the results were a little bit nicer than we expected, I have to say. We also performed placebo tests, so you believe me that we are not capturing something that is not the ECP, the effect of the access to ECP. So we made a very simple placebo test. We assigned random access to ECP, and we obtained no results. So we do believe that we are capturing the effect of ECP. So, to be finishing, we observe that the policy effects do affect men and women similarly. And we believe that it is because it has spillover for men. I kept here the effect on income, but as you know, I didn't show that. But I think that the most important thing for discussion today is the fact that we do not believe that the effect comes solely from the fact that a girl took a pill and prevented a pregnancy. We have some reason to believe, based on our data, and we should look into that, that people are also getting more contraception once they go to the doctor. There is way more consultations for ECP than actual ECP pills distributed. So we are guessing that when a student goes to the health center and asks for a pill, they also learn what mechanisms and how a girl actually gets pregnant. And based on this knowledge and sexual education, they probably share it with their classmates. And when they share it with these classmates, they all learn, and they are all more likely to finish education, to attend, to graduate, etc. So we have to research further. This is research in progress, but so far we have very fascinating results that we need to dig deeper. And thank you so much for listening, and I will thank you all of your comments.
All right, up next we have Zachary Bleemer presenting changes in the college mobility pipeline since 1900. Zach Bleemer is an assistant professor of economics at Princeton University and a faculty affiliate at Opportunity Insights. He is a labor economist who studies American higher education.
Great. Thanks to all of you for hanging around. 30 minutes to lunch. I'm going to be talking today about the college mobility pipeline in the United States. So let me start with a motivating figure. This is going to be probably the only figure today that uses data that many people in this room are very familiar with, the linked US censuses. So focus first on the black line. On the x-axis, we have parental income rank. Here in the linked 1920 to 40 US censuses, parental income rank is coming from a version of a Lido score that's based on parental industry, occupation, race, state, and farm status, self-employment status, one or two other characteristics. On the y-axis, I'm showing you the difference in kid income rank measured in income in 1940 between those who go to college and those who graduate high school but don't go to college. And so what I want you to see here is that curve is flat. The observational return to college, just the amount of money that kids make if they go to college relative to if they did not go to college, was roughly equal across the parental income distribution as noisily measured in the 1920 census. Now focus on the red dots. These are coming from the combination of two contemporary longitudinal surveys, the Ad Health Survey and the NLSY 97. In both of those surveys, you can see that the curve is very much not flat. The observational return to college going for kids from the bottom of the parental income distribution is on the order of half the observational return at the top of the parental income distribution. This project is going to be trying to understand when and why this change happened, that the relative return to college going for lower income kids has lagged behind growth in that return for higher income students. The paper I should note for this project is posted as an NBER working paper on my website. I'm going to do my best to run through a bunch of results, first understanding when this transition happened, and then understanding why it happened. And in particular, what we're going to be looking at is changes in the relative value of and lower and higher income kids' composition at different colleges and universities in the US. And second, those same two questions, changes in the relative value of and composition of college majors earned by young people coming from across the parental income distribution and going into college. And I'll conclude with just a note on how we think this has mediated intergenerational income transmission over the last 100 years. I think a key way in which this paper sort of aligns with and doesn't align with many of the papers that we've now seen over the last day and a half is that while we are using longitudinal administrative data in the early 20th century, we're combining those with longitudinal survey data that span the 20th century. So you can sort of think of this as big data reconstructed from small data in this context. We're not only using the historical US censuses as well as some contemporary census products, we're combining that with other data sets that allow observation of parental income, kid level of education and income in their 30s, as well as what college they went to and what their college major was, roughly decade by decade across the 20th and early 21st centuries by combining historical surveys with things like the Great Aspirations in Wisconsin longitudinal surveys in the middle of the 20th century, the amazing Project Talent database, which surveyed over 400,000 high school students in the early 1960s, and then followed up at age 29 to measure things like where kids went to college and their ultimate incomes, combined then with surveys like the NLSYs and the various NCES surveys like the ELS and the NILS, combined with the PSID, the Ad Health, and other surveys. So what you get from combining all these surveys together is relatively noisy measures from each of these surveys, most of which only have 5,000 or 6,000 individuals, but combined tell us this relatively large-scale story that spans the 20th century. All right, so let me start just by showing you in each of these surveys what the collegiate regressivity trend looks like. So what I'm going to show you is for each of these surveys, just show you the slope from the line that I presented on the first slide. So this is the equation, though I think it's easier just to stare at these coefficients. So what I'm showing you is for each survey, though they're estimated simultaneously, what is the slope of that first slide line? Positive numbers mean lower income kids get lower observational returns to college going than higher income kids. And so what you can see is across these surveys, each individual survey is noisy, but combined you can see from roughly the 20s, the earliest point we have, until sometime between 1950 and 1970, though I think exactly which time this was is unclear, there was almost no slope at all. There was hardly a relationship between kids' observational return to college and parents' parental income. You can see starting sometime between the 50s and the 70s, that slope becomes positive, such that in recent years, that return is now much larger at the top than the bottom of the parental income distribution. So this is sort of what we're trying to explain. Collegiate regressivity starts sometime in the middle of the 20th century, such that today, the relative return to college going is increasing. The way to interpret that is by 0.4 percentage points per parental income, 0.04 percentage points per parental income rank increase in the parent income rank distribution. Okay, so what the paper does is now decomposes this aggregate change in collegiate regressivity into a number of components. There could be changes over time in, for example, which universities lower and higher income kids go to. There could alternatively be changes over time in the relative value of the universities that lower and higher income kids go to. Same point for majors. And then the paper goes into a number of selection concerns, trying to understand changes in the relative test scores of lower and higher income kids who go to college, and changes in the relative value of pre-college preparation in long-run labor market outcomes. Long story short, we find very little role for selection, at least after 1970, in explaining these trends in collegiate regressivity. I'm not going to show you that evidence today just for the sake of time. Instead, I'm going to focus on these 2 points, one about institutions and one about majors, and try to show you what 3 large-scale stories we think primarily explain this growth in collegiate regressivity. So first, focusing on collegiate institutions. In order to study changes in the relative return to different institutions over time, we're going to combine estimates from Project Talent, which, as I mentioned, has this very large sample of college goers from the middle of the 20th century, and contemporary administrative estimates of the return to different colleges and universities. These are college value-added measures at the institution level. Think of this as the average wage in kids' early 30s of kids who go to these colleges, matching on simple observable characteristics, race, gender, and polynomials in parental income and SAT score, or in the middle of the 20th century, the IQ tests that were given in Project Talent. What I'm showing you is on the x-axis, historical measures of university value added, on the y-axis, contemporary measures. what you can see is that these are positively correlated, but far from perfectly so. And if you look, for example, at the top of the figure, you'll see that the fancy private universities that are today the highest return universities in the US were sort of slightly above middle of the pack in the middle of the 20th century in terms of age 29 at the time earnings of children. What we're doing in this figure then is taking the full set of university value added estimates and then comparing the average value of the universities that kids from the bottom and top parental income terciles go to when they go to college. And I'm valuing universities either in light gray using their mid-20th century valuation or in black using their late 20th century valuation. So the way to read this is, for example, looking at the earliest period we have. This is taking the universities that kids in the CPS Occupational Change in a Generation survey went to. They were reported in 1973, but these are kids who were born in the first half of the 20th century. What you see in that gray dot at the top left is that valuing universities as they were valued in the in the middle of the 20th century, low-income kids were going to slightly worse universities, universities that paid about 1 or 2% less on average to their graduates than high-income universities. Negative numbers mean low-income kids are going to worse schools. If you were to value universities as they were valued today, you would see that lower-income kids were going to universities that paid like 6% less on average. But of course, that wasn't their valuation at the time. What I want you to see in this figure is that over time, what has changed is less which universities kids go to, right? So both of these, there's some movement up and down, but basically they end where they started. Kids are going to quite similar universities that they were going to in the early 20th century, but the value of those universities has changed. The value used to be the light gray symbols, and now it's the dark black symbols. So story number one, a key reason for this rise in collegiate regressivity over the last 100 years, and in particular in the last 50 years, has been that lower income kids, despite going to the same universities, have been going to universities that are on relatively lower value trends. Those universities in particular being the satellite and regional public universities that have seen relative declines in student to faculty ratios, instructional expenditures per student, graduation rate, and our measure of institutional value added, relative to the flagship public universities where higher income kids tend to go and which have relatively improved compared to these satellite publics. So that's story number one. Story number two is looking at the two-year sector and the for-profit sector in the United States. So here what I'm showing you is the share of kids from the bottom and top parental income tercile who enroll first at a community college in the top two lines and at a for-profit university in the bottom two lines. What I want you to see is that while lower income kids have always been more likely to go to two-year schools than higher income kids, those gaps really widened in the 1980s. It had always been roughly a 5 or 10 percentage point difference between the two. That gap has now risen to about 20 percentage points and has stayed at about 20 percentage points. This increased diversion of lower income students has lowered the value of college going for lower income students because community colleges and for-profits tend to have relatively lower wage value added than four-year universities. You can see that there was a boom in for-profits during the financial crisis that was ended by Obama-era regulation. So for-profits really don't play a part in the contemporary story. All right, so the paper then goes through a bunch of work trying to just plot out the decomposition, the relative importance of each of these stories. I'm going to skip over that for the purpose of time to give you 1 minute on college majors here. So now turning from institutions to majors, what I'm starting by showing you is the relative observational value of different college majors in the US, estimated as early as we can from the Time Magazine survey of college graduates of 1947, which had information about major and wage, all the way through the Contemporary American Community Survey. You can see that somewhat interestingly, the relative value of different college majors has changed very little over the last 100 years. Engineering and business are at the top, humanities are at the bottom. The overall value of college relative to a high school graduate who didn't go to college falls and then rises. That's well known from other work. But the relative value of different college majors is relatively fixed over time. So now we can use that information, either valuing majors as they were valued at the beginning of the century or valuing majors as they were valued at the end of the century, and either using quite large disciplinary groups or very detailed, about 70 detailed college majors, to look at, again, negative numbers, meaning lower income kids are getting lower value college majors than higher income kids. Most of this figure is negative, but you can see there are large periods when these numbers are zero, that lower and higher income kids were getting the same value of college majors as measured from about 1920 to 1940 and from about 1990 to 2010. There are two periods when lower income kids were very clearly getting quite lower value college majors than higher income kids. That was the growth of the scientific research production in the US university in the middle of the 20th century, and recent years when two trends have driven this change. First, the death of the humanities, kids flowing out of low value majors, has primarily been driven by high income kids flowing out of the humanities. And today, there are more lower income than higher income kids in humanities degrees. And second, the rise in computer science, which has been primarily driven by higher income kids earning this very lucrative degree. I'm going to stop there. The takeaway here is for these three reasons, we think that the relative value of college going for lower income kids has pretty substantially relatively declined over the last 50 years. We think we have an understanding that explains most of that recent decline. And it's first order in understanding changes in economic mobility and intergenerational transmission of income in the US since the 1960s. Thanks all very much.
All right, and finally we have Devin, Bissky, Dziadyk presenting Little School on the Prairie, a push for structural change. Devin is a sixth-year PhD candidate in economics at the University of Toronto. His research lays at the intersection of economic history and geography and is currently focused on a variety of projects using newly available full-count Canadian census records. He will be on the job market in the 2025-2026 academic year.
All right. Well, first of all, thank you so much, everyone, for sticking around for the very last talk of this wonderful conference. And thank you so much to the organizers for including this paper. So this paper is going to be about one-room schools. So one-room schools really loom large in the American mythos, as well as in the development of education systems around the world. These schools are rural, ungraded, and are going to be primarily teaching children between the ages of about 5 to 14. The existing literature on them is somewhat contradictory. So there's been previous work really driven by Claudia Golden, which finds that these rural schools have low educational quality, poor resources, difficulty recruiting teachers, and lower educational returns. On the other hand, we also have research that shows that one-room schools are really able to be customized to local needs. This is especially important for immigrant groups, and really act as an amenity in rural areas. And so what this project is going to seek to do is to causally estimate what is the impact of one-room schools on children and their communities. And what I'm going to be doing for this project is I'm going to be utilizing the rollout of one-room schools in the Canadian prairies at the start of the 20th century. So I'm going to be combining some new full-count census records that we've all been talking about over the last day and a half, and then combining that with the near universe of school openings at the start of the 20th century. And really making use of a really unique feature of the Canadian prairies, where we're going to be able to spatially locate both schools and households to their exact land parcel. And this is a really unique feature that we're able to do in Canada that we can't do in the US or in other contexts. And so then from this, I'll be able to rely on some plausibly exogenous timing of school construction relative to a child's age to then be able to estimate what is the impact of having access to one of these one-room schools. The counterfactual that I want you to be thinking about here is this is a very early form of education. You either have access to a school or you do not. We shouldn't necessarily be thinking about education quality quite yet. And so what I'll find that exposure to one-room schools is going to decrease your likelihood of working in agriculture as an adult. It's going to increase your income. Canadian census data, we observe income starting in 1901. And it's also going to increase your likelihood of selecting into certain occupations. You're going to be more likely to become a teacher as well as a manager. And I'm going to interpret this using a forthcoming structural model showing that schooling can act as a push factor for structural change, driving people out of agricultural occupations towards manufacturing and services. So this is a quick map of what the Canadian prairies looked like along with schools in 1890. This is before the kind of major waves of European settlement start. So we have only really some schools in the southern part of Manitoba. By 1900, you start to see the expansion into Alberta and Saskatchewan. And by 1910, we basically have the rollout of schools across the entirety of the Canadian prairies. If we look just in the period of 1910, the schools are expanding incredibly rapidly. They're building on average a new school every day for over the course of 1910 and up to about 1950. This is an example of what one of these schools look like. It's a single room, very basic structure. The government would often publish standardized architectural designs so that you could build schools really quickly. You also notice that the school has a number. All of the schools that are constructed are going to be numbered. This is going to allow you to date all of them. So long as you know some of the opening dates, you can interpolate the rest. This is the location of that school today. It is the middle of Prairie. So similar to what we see in parts of Minnesota, as well as the Great Plains across the US, the Canadian prairies are quite featureless. And this is going to mean that we don't necessarily need to worry about other amenities or other things being located nearby. And this is a plaque that's sitting on this location. And one of the things that I want to point out about this plaque is that it lists out, first of all, the school name and the number, and it's going to list out an address, which is going to be the southwest quarter of section 27, township 48, range 24, west of the second meridian. This is going to give us a series of 4 numbers that's going to allow us to do all of the geolocation for all of our households and schools historically. So let's talk a little bit about the geolocation. So the widespread use of survey boundaries is a really unique feature to the Canadian prairies. So analogous to the PLSS in the United States, all of Western Canada is going to be surveyed as a series of squares. In other contexts, it's really difficult to geolocate rural households. I've done some previous work trying to do this for the UK. If you can get anything about 10 or 15%, you're doing pretty good. Here, I'm going to be able to do a lot better. So I can geolocate about 70% of rural households to a 1 mile square across 3 different census waves. This is dramatically better than what we can get in other contexts. And I'll be able to locate about 92% of schools combined with their opening years. That's relative to the number listed as operating. So I'm doing pretty good on the schools. So this is actually an example of what a census record looks like just coming straight from Ancestry.com. So this is for a single family, and you'll notice this list of 4 numbers. It's listed there, the 5, 40, 1, and 3. These correspond to the land parcels. So I can take that family and I can plot, this is for a single 6 mile by 6 mile township, all of the people that live in that area. So this is one township of 6 miles by 6 miles. Across the Canadian prairies, we have about 2,000 of these. And then across all of these, I can locate each of the individual families and where they live. This township has a particular significance to me because the bottom row, 3rd column is actually the location of the farm that my grandfather grew up on. So I know that this one in particular is reasonably accurate. The next thing that we'll need to do is we'll need to do some census linking. So I want to follow children linking their census observations in 1906 to later waves in 11, 21, and 31. And unlike the US, Canada does not have a public set of links available to be used. So what I've done is I implemented the MLP method used and developed here at IPUMS to link the US Census records, but then implemented it on the Canadian records. As the first pass of this, I had a number of great conversations with the wonderful people here and realized that I can use the US training data and then calibrate a model based off of that to then do the Canadian linking. We're in the process of collecting some Canadian training data. The initial results there suggest that the Canadian data actually looks a lot like the American data once you recreate the same features. I'll be able to match about 26% of children from 1906 to 1911, smaller 16% from 06 to 31. This is lower than what you get with MLP, especially as we've seen with recent editions of it in the US, more similar to what you get with like an ABE. This is also somewhat expected. There's a lot of Canadian immigration that's occurring at this time. As we've seen with certain subgroups, your match rates are going to be a lot lower. So overall, I'm feeling okay about the matches. One thing I will say from this experience is that if you are doing large-scale matches, I would really consider working with something like MLP. For context, you can match 2 full count waves of the Canadian census, which is about 10 million observations to 10 million observations, in about an hour and a half on a computer with 16 gigs of RAM. So you can do these things quite rapidly if you want to. So the first thing that we want to establish is, does distance actually affect schooling? And I'll find pretty conclusive evidence that yes. Distance is mentioned repeatedly as a barrier to school access. So I'll start off by linking our 1906 data, where I have school locations, to 1911, where I have school attendance. And I'll find a very clear spatial decay pattern in terms of the likelihood of attending school as a child. The next thing that I want to be able to do is I want to be able to estimate this difference in differences. So I'll be borrowing the same difference in difference strategy that Anthony was using by comparing across cohorts and then looking at those that had early access to school versus those that didn't. So my comparison is ultimately going to be between those who are in an early cohort, I'm taking the 0 to 5s, and those who are older, the 12 to 17s. The argument being is that the really young cohort, they're going to benefit from school construction. The older cohort, by the time you're 12 to 17, if a school gets constructed nearby, it's not really going to benefit you. And then I'll take you as being treated if the distance to school decreases by 5 kilometers or more from 1900 to 1905, conditional on it being close enough to actually matter. So this is just a quick little diagram that I drew up. You have a given household there in the far left. I'll take you as being treated if we see that schools are moving a lot closer to you as part of this construction process. So turning to the results, I'll find very significant increases in income. This is one of the joys of using Canadian census data, is that we can actually take a look at income from a very early area. I'll find about a 12% increase in this. I can look at the likelihood of you engaging in farm work. I'll find a decrease here, but it's mainly going to be for the youngest cohort. I'll find this specifically looking at the individual. I'll also find this if I look at the whole family. So we kind of expect that there's going to be a broader impact on the whole family if we do have this kind of structural transformation process occurring. I can do some splits, let's say looking at individuals relative to railways. I find that treated individuals are also more likely to move away from home. They're more likely to be employees as adults, and things are robust depending on how I vary treatment cutoffs and how treatment is defined. One of the other things that I can also take a look at is occupations. So I've coded up the occupations with the occupational HISCO scores. I'll now be redoing that because I now know that there's a better way to do it. And one thing I'll find is that there's a real switch for kids that are treated towards becoming teachers and managers as an adult. This is restricted purely to the male sample. Canadian census records, we don't have really great marriage records, so we can't necessarily track women yet. So it is somewhat surprising to see teachers having this strong effect, because the majority of teachers at this time are actually women. The final thing that I've computed here is to look at land consolidation. So if schools push people out of agriculture and farms are primarily owner occupied, as they are in this region, we would expect that farm sizes would increase. And so we can't observe farm sizes directly, but I can infer them by looking at the density of neighbors. So I can take a given location, compute a Voronoi polygon around it, and then take that as a measure of the farm size. It's imperfect. I've done some validation here to basically show that it correlates with the types of things we'd expect with farm size. And I'll find that areas near schools see an increase in their farm size by about 5%, which is nearly identical to the decrease that we see in agricultural employment, suggesting that there's a mechanism here whereby you get a school constructed nearby. This causes agricultural outmigration, and in exchange, the people that remain accumulate more land in the surrounding area, and their farms increase in size. So in conclusion, this project has focused on the role that one-room schools play in the development of rural areas. Exposure to these schools leads to agricultural outmigration and switching towards higher skill services and farm consolidation. This is consistent with the macro literature, which has emphasized the role of education in structural transformation. To do this, I'm utilizing this new Canadian full count census data, which is now linked across waves. There's a lot of new stuff that we can start to do with this data. It's a really exciting time to be a Canadian researcher to be working on some of these problems. All right, thank you so much.